to Smitty's Learning Room. Today we're going to continue to have a look at point 2.2.1, in particular having a look at diabetes. So the nature and extent of diabetes, the risk factors for diabetes, the groups at risk, the protective behaviours, the socioeconomic, sociocultural and environmental determinants as well. So we start by having a look at what is diabetes. And in short, diabetes is the inability to break down and use sugar. Now, insulin is the hormone which is produced by the pancreas, which helps the body use glucose for energy. So if the insulin levels in our body aren't right, we can't break down sugar and allow our body to move by using energy. So therefore, people who suffer from diabetes have an issue in that they can't provide their body with enough energy to function. Having a look at diabetes, we have three types of diabetes. We have type 1, type 2 and gestational diabetes. Now type 1 diabetes is insulin dependent. So basically with this one, there is a minimal or no insulin which is evident in the body. And it's basically controlled by injecting insulin into the body. So you'll see people who suffer from type 1 diabetes will often test their insulin levels regularly, and if needs be will inject insulin either via a needle or via an insulin pump. Some symptoms for type 1 diabetes are unusual thirst, excessive need to urine or go to the toilet, weight loss and fatigue. And type 1 diabetes is usually found amongst children and young adults. So it's something that's sort of developed earlier on in life rather than later in life. Type 2 diabetes is non-insulin dependent. So that means that there's insulin there, but it's not necessarily sufficient or effective for the body to be able to function properly. And type 2 diabetes is controlled by lifestyle changes. So what can we actually do to prevent type 2 diabetes or to decrease the effects of type 2 diabetes is doing things like eating a healthy diet, increasing our level of physical activity. With type 2, there's actually a lack of the symptoms, and basically there are a lot of these cases of type 2 that go undiagnosed or unidentified. So the statistics, data and trend around type 2 diabetes is probably not actually reflective of the amount of people that suffer type 2 diabetes because they're not aware that they actually have the condition. An increase in inactivity and poor diet are the main contributors to type 2 diabetes. So basically lifestyle factors. Type 2 diabetes is most prominent in people who are above 50 years, although there is an increasing number of young people who are now contracting type 2 diabetes. The third type, gestational diabetes, generally happens during pregnancy, and in about the 24th to the 28th week of pregnancy, this is when doctors test for this type of diabetes. And diabetes, when you contract diabetes when you're pregnant, so gestational diabetes, usually disappears after birth. In saying that, if you have suffered from gestational diabetes, you're at an increased risk of type 2 diabetes later on in life. If the case of gestational diabetes is quite severe, there's insulin is used to control the blood glucose levels for the pregnant mother. And obviously the people that this affects is just pregnant women. If we have a look at the extent of diabetes in Australia, you can see that it contributes to about 5.4% of deaths in Australia. Now this rate has increased significantly, and there's several reasons for that, but one of the main reasons is probably that we have more people actually getting tested for diabetes, so that we now know that type 2 diabetes, a lot of those cases go undiagnosed. So now that we're testing for diabetes earlier, people are being diagnosed for type 2 and either treated, or if they pass away, it could be a contributing factor. So therefore, that contributes to the extent and the trends of diabetes overall. When we have a look at the extent of diabetes within males and females, males have higher rates of diabetes at 6% and females are at 4%. The groups most at risk of diabetes are 65 to 75-year-olds, and the 50-year-old year group is actually increasing. If we have a look at the extent of diabetes within the specific types of diabetes, with type 1 diabetes, we're getting on average 7 new cases of this diabetes per day. The incidence of diabetes is stable, and it's obviously there's an increased chance of type 1 diabetes amongst at-risk communities. When we have a look at type 2 diabetes, this equates to 4.7% of Australians have type 2 diabetes. Now, as discussed, this could actually be quite higher than what it is. It's just that most of these cases go undiagnosed. The rates of type 2 diabetes are higher in men than what they are in women, and obviously 2 times higher for those people with low SES, and that's basically because we have a higher population of ATSI people living in those low SES areas. When we have a look at gestational diabetes, it's 5.8% of pregnant women will suffer from gestational diabetes, and of that 5.8%, about a quarter of those people will receive insulin treatment in hospital. Now we move on to the risk factors for type 1 and type 2 diabetes. Now, having a look at the risk factors for type 1. Now, remember, type 1 is you're more prone to contract type 1 diabetes in the younger ages rather than the older ages. So a family history of type 1 diabetes and obviously the genetic makeup will have a huge contribution to that. Drinking water with increased nitrates in it can also contribute to type 1 diabetes. Low vitamin D levels have been found to contribute to type 1 diabetes as well. Diets that are high in omega-3 fatty acids can also contribute to type 1 diabetes. The other thing that can also contribute to type 1 is an exposure to viruses. So basically what happens is that if a child contracts a serious virus at a young age, these can actually destruct the cells that produce the insulin within the pancreas. So therefore the body has insufficient insulin supplies to break down sugars to provide the body with energy. Moving on to type 2 risk factors. Now, as we talked about before, type 2 diabetes is something that's contracted later on in life, so usually over the ages of 50, and is mainly a result of lifestyle behaviours. So if we have a look at here, basically 45 plus years old is a risk factor for type 2. If you have an increased blood pressure, if you are overweight or have a family history of type 2 diabetes, you are more susceptible to getting type 2. If you've had heart disease or heart attack, this can also contribute to type 2 diabetes. If you've had gestational diabetes during pregnancy, that can also contribute to type 2. And other factors include being overweight, from an ATSI population group or from a low socioeconomic population group. Now we move on to having a look at some of the protective factors for diabetes. So a lot of protective factors are based around type 2 because, as we know, type 2 is connected to behavioural. Now, if we look at the list of protective factors here, a lot of them have to do with healthy eating and diet. So eating a variety of nutritious foods and eating plenty of vegetables and grains and fruit is going to decrease our chances of getting type 2 or type 1 diabetes. Obviously, if we have a diet that's low in fat, will also contribute to this, as well as a diet low in sugar and salt. It's important to encourage and support breastfeeding for newborns because that's also a protective behaviour or a protective factor against diabetes. Regular physical activity and limiting alcohol intake is also a protective factor. So now we move on to the socio-cultural, socio-economic and environmental determinants for diabetes. Now remember that the determinants are things that can determine our chances of contracting a disease. So if we have a look at the socio-cultural determinants, we know that ATSI have an increased risk due to decreased education about the risk factors for diabetes. So if they have a lack of access to knowing about the risk factors, then they can't make changes within their lives to try and protect themselves from getting diabetes. The trends and data show that the people from Pacific Island, Indian or Chinese cultural backgrounds are more susceptible to diabetes. As we know, a family history of diabetes increases our risk of diabetes, and high saturated fat diets contribute to an increased incidence of type 1 diabetes amongst the 0 to 14 years age group. Having a look at the socioeconomic determinants, we know that generally across the board. Low socioeconomic status people are less educated and therefore are at increased risk to poor health. So in relation to diabetes, they're at increased risk due to the fact that they have increased consumption of alcohol, they are more likely to be physically inactive, and their diets are generally high in fat and sugar as a result of lack of access to education about healthy eating or healthy dieting, and also a lack of access to resources and healthy food. When we look at the environmental determinants, a huge factor in this is technology and access to technology. And the statistics show that access to technology has led to a decrease in physical activity rates, especially amongst young people, which is obviously a concern because we know that young people are more likely to contract type 1 diabetes. And we also know that the rates of type 2 diabetes is actually increasing amongst young people. And obviously an increased access to technology is contributing to this. Interesting, the incidence increases as you travel away from the equator. So if we're having a look at countries that are at the extremes of the equator, so for example, Finland and Venezuela have increased rates of diabetes. There are several reasons for this, but some of them could be that they experience variations in their climate, and not just subtle variations like we experience here in Australia for definite seasons. Countries further away from the equator have quite extreme seasons, and therefore if you're experiencing extreme periods of cold or extreme periods of heat, you might be more inclined not to be physically active, and we know that decrease in physical activity is a contributor to diabetes. Now that this is the final video in this little mini series here, it's important to remember that you need to know in depth cancer, cardiovascular disease, and one other for your HSC. Now, these 3 videos cover cancer, cardiovascular disease, and diabetes. So these 3 videos should be enough to sufficiently support you for those syllabus dot points.